All right, hello and welcome. My name is Dr. Yanuck. As always, I'm joined by Maria Lloyd, our wonderful therapist. This is Catalyst for Healing. Thanks for joining us. Today's episode I'm really excited about, and that is the importance of music with ketamine.
Yep.
When I first started this whole process, the first thing I did was try and make a playlist for it. Like before I incorporated, before we had any of the supplies, the place, anything, I was like, okay, I gotta figure out what the playlist is gonna be. And I spent probably a year.
You guys have an amazing playlist,
I probably spent a year refining that playlist.
Wow.
Just because I was like, we'll get into it, but I think there's a lot of intentionality that should go into the music experience.
Yeah.
And I think it plays an enormous role in terms of what the experience is like for you. And we're gonna get into what that is.
Yeah. And we call it the therapist in the room with you is the music.
Yeah,
right?
yeah,
Because it's literally guiding and directing you. And
100%.
Mm-hmm.
So I think it's interesting to note that the vast majority, 90% plus of all the clinical trials that have ever been done on psychedelics and their effects use music in both the control and the placebo group.
Yeah.
Right? I think it is just foundational knowledge and an assumption that music is critical to this experience. And I find that just intrinsically very interesting.
Yeah.
I think they're right, but at the same time, I think it'd be really interesting if they started to do some more studies that maybe didn't do music or tried different types of music.
Yeah.
And I think that's an area of growth for sure in the research field moving forward, because we know from working with our patients, from personal experience, that music can have a massive effect on where you go with the experience.
Right.
So maybe just to start off with, like, maybe you can give a little bit of an example of like what your experience has been like with various maybe music playlists with ketamine, because you've been very open about your ketamine experience.
Yeah.
Maybe go start there.
Well, and I think that, as you said, 90% of the research is showing it with music and why it's so important, but not 90% of clinics are using music in the right way. And so the reason we want to make sure to talk about this is to help you figure out, if you have a clinic that you're going to that doesn't utilize music in the right way, you can bring in your own music and have that be a powerful experience for you. And that's what I had to do for myself when I was going through my initial treatments. There is an app, I think one of the best apps is called Field Trip. And the people who designed the app were the very early adopters to do ketamine assisted psychotherapy. And so what's cool is they have a bunch of music. It's a free app. Download it. It's got a little psychedelic picture on it. And then you can try out different types of music clips and see what you like and bring in different types of music to the experience and see what that's like for you. So there's a lot of different ways on Spotify. You can search tons of psychedelic playlists.
You can just type in ketamine playlists on Spotify and you'll probably have over 1,000 options.
Right. You guys have a cool one called Renew Mind Manifesting.
Yeah, I'll link it in the description. But before I go into kind of like my thoughts and intent behind a playlist, maybe just tell me a little bit, like give me an experience of like with music and how it was for you.
So there's something about the journey that it's like the music is carrying you. And so there's times where you're like floating and it's light and fun, and then there's times where it gets more intense and there's more fear that might come up. And so it's kind of it's really defining the whole journey in a lot of ways by the different sounds and feelings that it's bringing in. So I just had such different experiences based on the type of music that I'm listening to.
I mean, imagine Star Wars without the score, right? Without the music. It's not part of the dialogue, it's not part of the visual, but it is critical to your experience, right? And I think the important thing to consider with music is how suggestive it can be and where it can take you. And so when I, was setting up our playlist, something that I was really intentional about was trying to acknowledge the fact that the ketamine doesn't start at 100, right? It is a slow build up to your peak, and then it's a slow come back down, right? And so I think if you are starting to either look for your own playlist or build your playlist, a couple of things that I would recommend. First of all, longer songs are better. I think especially as you get deeper into the experience, as you transition from one song to the next, that few seconds of that song going down and the next song building back up, that's jarring because you've been in this flow state for an interminable amount of time, right? Kind of like
the
with
40
this,
minutes that
whatever,
feels like 5 hours.
Right, yeah. You've been in this like beautiful vision or whatever it is with this music, and then the music starts to go down and you're like, wait, oh, whoa, that's right, I'm back here. And then a new song comes and it's almost like takes you a little bit to be like, okay, like I'm gonna try and get back in it.
Yeah.
Right? And then it's like, okay, where's this one going? You gotta get more comfortable with it, and then you go. I think the value of longer songs, and when I say longer songs, like aside from earlier on in our playlist, most of our songs are 10 plus minutes. So, I mean, there's an argument to be made for like just having like a 40-minute song, but I do think that the beauty of having a couple different types of songs is it allows you to experience different things within one experience.
Right.
And so when I created the playlist that we have currently, I started with a couple shorter, just happier songs, right? I'm not trying to start dark. I'm never trying to go dark. Yeah. But just like happier, more ethereal, atmospheric music, really light, no heavy percussion, no vocals, period.
Right. No
words. Vocals, period.
Yeah.
Right? We have people that I love music, and we have music lovers that come in all the time, and ultimately it's your experience. Yeah. But a lot of times they're like, oh, can I just listen to a soundtrack I've made? And it's like Shania Twain or something. Right. I'm like, oh, like, I just don't think so. Because the problem is you're going to be, especially if it's someone you know, you're going to be locked into those lyrics, and it's going to take you somewhere very distinct. And maybe there's a reason that you want to do that, but I think to really explore the mind in places that you're not used to, you need to be away from music that you know, and it should be something that's just more in the background and setting the mood, right? These shouldn't be songs that you can predict the next beat. It should just be something that's flowing behind you. With that, you don't want a bunch of weird discordant sound that's like, you know, Space Odyssey or something crazy, but you want something that's just calm and atmospheric. So yeah, early on our playlists start shorter, and then as we know that most people at least are starting to get deeper, our songs get longer. And our songs go from kind of light and ethereal to we have one song that's a bit darker. I think the tones would largely be considered as dark. And it's not meant to put someone in a place that they don't want to be, but I think I like to give people the option to go there. And some people will ask us to skip that song. Like it comes on, they're like, can you skip it? We tell everyone ahead of time, if something's not working for you, raise your hand, we'll skip the song. Because we're with them. But a lot of people will acknowledge that song as like it really took them somewhere deep. And then as we're kind of coming to the peak, we have like a crescendo where we have like a big, a song that kind of like it really climaxes, and it's really bright, it's really energetic. And then we have a couple songs that start to parachute you down as you're coming down. And I think if you could think about it in a way of like, you want to start confident and good, and I'm here, I'm showing up, explore kind of the deep, dark recesses of your mind, get to that beautiful climax, and then work your way down. I think it's a good general sense of how you should try and set this up. To each their own, but having done this for a while and modified it enough, I think it works. The soundtrack people continually go back to the most is the original one I created, in terms of like in our clinic, I should say. Have you noticed with the music that oftentimes like you have a different relationship to sound in and of itself? Do you know what I mean by that? Yeah,
I mean the sound in terms of, you know, everything's a little bit more amplified, and so explain that.
It's interesting. You know, I'm not trying to mislead you. I'm just curious what your question was, or what your answer is. We've had some patients, maybe it's slightly more musically minded, that like feel like they can feel the music. It's like it's part of their body. We've had others that like can see it. Like they see the musical notes going by. We've had composers and musicians come by, and they can see these like, you know, we have one that's like kind of like a more wind instruments, and they can see the sound waves from the flute kind of going by, and I think that's so cool.
Mine like put me in different destinations. Like I had one that was like, and I'd been to Costa Rica, and then it was like a Costa Rican vibe, and I was like back in Costa Rica because I was listening to it.
So interesting.
And so I feel like that can happen where it's like places become more vivid.
That's so interesting. Yeah. I mean, I think that there is some intentionality you can do if you really are, trying to explore something specific. If you know that there's music that would take you there, that would remind you of that time or that space, that'd be an interesting thing to explore. I can't say I've personally seen that, but it's something that just came to mind because the music is so suggestible. Yeah. And I think that's an important consideration is when you're making the decision for the music is to be cautious that is this where the general tone of this, is this where I want to go in my experience? Yeah. We recommend you listen to the playlist beforehand at least once or twice to kind of have a general sense of it. Mm-hmm. Most patients in our clinic will do that. Some people will bring in their own playlist, but the vast majority just stick with our playlist. For you, you've had a couple different experiences. Yeah. Have you made your own playlist before, or have you used others, or?
I just had a variety of playlists that I've used. Yeah.
When the music itself for you, is it ever feel like too much? Like, have you ever felt like the need to like take off your headphones or turn the volume down, or you always feel like you're able to be with it?
I've always been able to be with it, but to your point, if it's too dark, it can be a little bit much. Yeah. So I try to steer away from like super dark stuff, even though I like kind of what you're saying, like having one song in there that's kind of bringing up maybe some darker material. Yeah. But
I would say it's like light dark.
Yeah. Yours is very light.
I should say diet dark.
Yeah.
It's like it's not a super dark emo, but it's just like some subtle notes that are like, oh, this is like kind of like a little eerie. Yeah. And I think it's so interesting how like such specific note patterns, like musical note patterns, can make people feel something so quickly. Yeah. And I think it's an interesting thing to explore in this space. Mm-hmm. And so over time, people will oftentimes modify the playlist. Like they will give us feedback about like, I'd rather this one here or that one there, and that's great. I think it's something that you should feel comfortable advocating for yourself as your experience. There's not one playlist that works for everyone. Yeah.
But we do know, like, there are clinics probably that don't have any music at all. So in that case, I mean, enhance your experience, bring your own music. Yeah. Because without it, I do feel, and you said you've had the client.
Only once. Or, one memorable one where they deliberately went without music. Yeah. And it was just, comparing it to the ones with music, they just said it was like a vastly inferior experience. Just really light, couldn't go anywhere with it. Yeah. At the end of the day, a part of the music is just to remove external stimuli, which sounds odd because it is an external stimuli, but you're trying to like get out of this world. Exactly. Right? And so we use noise canceling headphones. I think if you can get something that's relatively noise canceling, that'd be beneficial. We try our best in this clinic to really be quiet. The staff is not talking to each other. We're not getting up, walking around, but there's inevitably going to be the occasional door closed or someone coughing or something like that. And so if you can really be internal, removed from all that sound, that's another power of kind of these headphones and that music. Sure. We try and turn the music up kind of as loud as people can tolerate. We always start high and then say higher or lower, and then usually people want to go lower than that, but we don't want to set people up to like just be slightly high enough, Right. We also use music as a cue for like where you are in the experience. I think time can become very relative in this space.
That's a really good point.
So maybe do you want to speak about that more with how?
Well, yeah, because I've done some infusions here, and so now I'm really used to your playlist because I've used it, several times. It is helpful because it's kind of anchoring of like where I'm at in my journey, because you do lose a total sense of time when you're in it.
Yeah, and so I think, one, getting familiar with the playlist, then you kind of have a sense of where you are, as much as I think sometimes it's helpful to almost not know where you are, to just really be open and free. But I think the one thing that's always good to have is, we tell patients that about 15 minutes after the infusion's done is we will start to turn the music down. Not so much to like end it for you, but for just as a cue that like, hey, it's done. Yeah. Take your time, explore, because oftentimes you have another at least 10 to 15 more minutes of exploring the feelings and the thoughts and the visuals, although it does kind of taper off pretty quickly. It's a nice cue to be like, okay, I know I've reached my peak now, I'm just going to kind of enjoy as I parachute back down. Yeah. And that, I think that in and of itself, that could be really valuable. I can't imagine
that helped
having
me that
no
time
sense of, having no sense of time. Like that would be so terrifying to me.
Well, because at one time you increased, I think, my dose, and it was like I don't know, I felt so much more out of my body than I had before, and then I knew it was coming to a close, and it was like kind of comforting because I knew the music was like, okay, I'm coming back.
Right, yeah.
You know.
It is, that's an interesting point you make, because I think there's, especially as people get more comfortable with it, and they start to feel more comfortable letting go, I think oftentimes people really look for like just after the peak.
Yeah.
Like, as it's building, you're like, oh my God, is it gonna get bigger than this?
Right.
Oh my God, it's bigger than that? Like, it can't possibly get crazier than this. And then it gets crazier, and you're like, then you start to brace down, and you're like, Jesus, where's this going?
Right.
And once you start to feel it coming back down, is when you're like, okay, whew, okay, I've reached the peak, now I can kind of just enjoy this kind of coming down process. So I think the beautiful thing about ketamine is it's quite predictable where you're gonna get that peak, which is right around that 30 to 40 minute mark.
Yeah.
And the music kind of also cues you into like, oh, I'm at this song, I know I'm close to it. Right? And little things, and these are things that over time you'll get more comfortable with. I think to summarize in terms of the critical things you should think about with music if you're making your own playlist, no lyrics, highly recommend no lyrics, longer songs, and ideally songs that are light, atmospheric, effervescent, ethereal, whatever word you want to use for something that you know it when you hear it. It's like spa-esque music, right? Hopefully it should feel right to you. You don't want to be so familiar with the music that you know every beat of it, but you want to have some comfortability with it to know where it's going. And I think making sure there's no ads.
Oh,
we
that's
learned that
huge.
lesson the hard way. We had a patient that was like really wanted to use this YouTube playlist they had, and we're like, we can try that. And we put it on, and then like 5 minutes into it, he's like, I'm getting an ad for cereal. Something like that. I was like, oh my God, it's terrible. And we're like, so sorry. So yeah, obviously just like go through the motions, practice it, right? Like do a trial run to make sure you're not gonna have anything unexpected.
Right.
Make your transitions longer. So like on Spotify, a lot of things you can basically make the music dissolve 10 seconds before it ends, and the next song would start 10 seconds before it ends. Inevitably, most music has 5 to 10 seconds of just dead air, which is not what you want in this, right? Because that leaves you to like, oh gosh, like you're just stuck in your thoughts, and you want to have the music kind of guiding you along. And so when you have it kind of dissolve and then the next song come back up, there's less of that harsh transition.
Yeah.
Almost every music app has this. If you just go to like settings and transition or dissolve or something like that.
Yeah.
Anything else you want to add to it?
I just think it's an important aspect. We wanted to address it just because, you know, it's just such an important piece of the experience and guiding the experience. And if you have the chance to kind of curate it and make it your own, it's just a really kind of fun part.
Yeah, and this is not just for like IV. This is for intranasal, Spravato. This is for troches. Like I think all of it would benefit with music.
Absolutely.
100%. Okay, well that was kind of it. I mean, obviously we didn't go into the research. I think in a future episode I would love to dive into the research a little bit more about the importance of music. But as you can tell, I care about this space a lot, specifically with music. I'll leave it at there. If you have any questions, of course, you can reach out to Maria or I. Would be happy to answer any questions. I'll link our playlist in the show notes. I'll link the field trip app in the show notes.